So here we have a blood gas. pH is 7.35. The PaCO2 is 55. The bicarb is 35. And the PaO2 is 55. First, we're going to look at the pH, CO2, and bicarb. We won't worry about the PaO2 at this time. What is your pH? 7.35. Remember, the perfect normal is 740. So here we're at 735, which is on the acid side, and it's in the normal range, which goes from 735 to 745, but it is acidic normal. So we're going to call this acidic. pH, acidic. PaCO2. Let's look at PaCO2. The normal, perfect normal is 40. We have a range of 45 down to 35. Well, we're way over the normal range. We're at 55. What is CO2? CO2 is, of course, an acid. We've always said that. CO2 is an acid. So we have more of it, way out of the normal range. So we have a lot of acidic condition here. So our CO2 is acidic. At this point, you can almost say we have a pH, that's acid, and a CO2, that's acid. So you can say we have a respiratory acidosis. The CO2 is controlled by your ventilation, by the respiratory system. So we have a respiratory acidosis. Let's look at our bicarb now. Our bicarb is 35. Remember, we have a range of 22 to 26 and a perfect balancing point of 24. Well, we're 35, so we're way higher than that. That's a really high bicarb. And what is bicarb? Remember, bicarb is a buffer. So we like to say a buffer is a base. Let's call it a base. A buffer is a base. So we have a respiratory, CO2 is 55, acidosis, the pH is acidic. And what is the bicarb doing? It has saved itself through the kidneys and now is trying to buffer that CO2. So we're compensating here. So we have a compensation. So we have a respiratory acidosis that is compensating. And are we fully compensated or partially compensated? Is our pH back into the normal range? Yes, it is. So since it's moved back into the normal range, we are fully compensated. Fully compensated respiratory acidosis. If we were fully compensated respiratory acidosis, we know that the kidneys are where we save our bicarb, and the kidneys are slow acting. It's not going to act, it's not going to save this bicarb in 10 minutes, 20 minutes. This is going to take days, weeks, maybe even months to compensate that, depending on how good your kidneys are. So this is a chronic condition. This is not acute. This is a chronic respiratory, fully compensated respiratory acidosis. Now we do have a PO2 here that we can look at, and the PO2 is also low. How low is it? We have three different areas of hypoxia. There is mild, moderate, and severe. I like to say severe. What is our normal PO2? Our normal is 80 or better. 80 or better is normal. So mild starts at 79 and goes down 20. 79 subtract 20 is about, or 80 subtract 20 is 60. So this is mild. Then we have moderate, which starts at 59 and drops down about 20 to 40. And then we have severe. which is anything less than 40. So we could say here we have a fully compensated respiratory acidosis with, where are we? We're 55, with moderate hypoxemia. Moderate hypoxemia. Thank you. Let's see how that turned out.